Hi everyone, welcome to my channel Capsa. In this video tutorial, I will discuss about Alzheimer's disease. So Alzheimer's disease, also called as senile dementia. What is senile? It's a modified Latin word which stands for old man, and dementia we can write like this. Dementia stands for D means loss, ment stands for mind, and IA, this suffix stands for state. So in combined form, dementia means a state out of mind. Now, the word Alzheimer's actually comes from Dr. Alois Alzheimer, which was a German psychiatrist and pathologist who first described the disease in 1906. Now, what Dr. Alzheimer studied? In 1906, he notices some changes in the brain tissues and discovered that the presence of amyloid plaques and neurofibrillary tangles of a patient sample. And the name of the patient was Auguste Deter. Okay. So, Alzheimer's disease, we can say it's a kind of neurodegenerative disease where neurons gets damaged of the brain that causes clinical dementia with memory impairment and specific microscopic pathology. Which kind of microscopic pathology? First one is senile plaques and second one is neurofibrillary tangles. Okay. So senile plaques mean nothing, just a extracellular deposits of fibrils and amorphous aggregation of a specific protein, amyloid beta peptide or amyloid protein. And neurofibrillary tangles are intracellular fibrillar aggregates of a microtubule associated protein named tau, which is so much hyperphosphorylated and oxidized. Okay. So if there is a hyperphosphorylation and oxidation of the tau protein occurs, what will happen? I have told that tau is a microtubule associated protein. It means this protein binds with microtubule and provides the rigidity to the axons. Okay, so if there is a hyperphosphorylated oxidized condition, tau protein will impair or loses its ability to bind with the microtubules. As a result, there will be tau aggregation which will shows the impairment of the axons. Okay, and interesting fact is in about 2000 BC, the ancient Egyptians were already aware about that memory will decline with age. Now we will understand through a picture what is senile plaques and neurofibrillary tangles. So this picture represents what are neurofibrillary tangles, what are amyloid plaques. Okay. First picture represents normal structure of neuron. After formation of neurofibrillary tangles, the neurons will looks like this. These are the tangles. Okay. And this is the deposition of the amyloid protein. It's a healthy brain. It's a brain of severe Alzheimer's patient. Okay. And in this picture, you can see the plaques and tangles formation. So ultimately, plaques are due to the deposition of amyloid beta peptide protein or amyloid protein. Okay. And tangles are due to deposition of tau protein, which is a microtubule associated protein. Clear? Now we will understand what are the risk factors. So coming to the risk factor, first one is age. More the age, more will be the possibility to develop Alzheimer's disease. It is studied that above 65 years age old age patient will more prone to Alzheimer's disease or AD. Second one is family history and genetics. Genetics means obviously it will be the hereditary condition or not. And family history means if there is one of the family member affected with Alzheimer disease or not. Okay. Third one is lifestyle behaviors. Which kind of, like if there is a lack of physical activity, improper diet, if you smoke, drink alcohol, if there is any kind of social isolation, this kind of. Next one is medical conditions. Which kind of, like if you have diabetes, if you have depression, if you suffer from obesity, any kind of cardiovascular disease, or if you have previous medical history like head injury. Last one is environmental factors like air pollution, if there is an exposure to toxic metals, pesticides and insecticides, this kind of. Okay. Now what are the causes? So causes of the Alzheimer disease is very much complex, and it is thought to be caused by a combination of age-related changes in brain along with genetic, environmental, lifestyle factors. But the key part is the buildup of the two proteins inside the brain called amyloid and tau protein. As a result, atrophy of the brain. What is atrophy? Nothing, just shrinking of the brain. If there is atrophy of the brain, obviously it will decline the memory, thinking, learning, etc. So based on the various studies and clinical findings, causes of AD can be described based on the two hypotheses. First one is cholinergic hypothesis, second one is amyloid hypothesis. Okay, now we will understand broadly. So first one is cholinergic hypothesis. Means here cholinergic neurons are involved. It's a function of acetylcholine. Now we will understand. Acetylcholine actually takes part in an essential role for cognitive functions. What are cognitive functions? Like memory, attention, learning, etc. So if there is a degeneration of this kind of neurons takes place, obviously there will be decrease in the acetylcholine concentration, which will leads to cognitive dysfunction. So what I have said, that in AD or Alzheimer disease patient, what happened? Degeneration of cholinergic neuron takes place. As a result, it will decrease the acetylcholine concentration, which will leads to cognitive dysfunction or alteration in the function of cognitive behavior. And studies also found that deposition of amyloid protein causes reduction in the choline uptake and also release of acetylcholine. So according to studies, if there is increased concentration of amyloid protein, it will leads to decrease in choline uptake and also it will decrease the release of acetylcholine. This is first hypothesis. Okay. According to second hypothesis, amyloid hypothesis, it states that according to studies, abnormal deposition of beta seeds in central nervous system has a strong correlation with dementia. So normally amyloid plaques or proteins actually deposits in the brain, normally deposits. But if there is a kind of pathological condition develops, it will cause degradation of the amyloid peptide. Now, if there is pathological condition, what it will causes? It will causes degradation of amyloid protein, which will leads to formation of two kind of peptide. first peptide and amyloid 42 second peptide. And if there is increase in the ratio of these two peptide, it will induces the amyloid fibril formation, which will leads to neurotoxicity. Clear? So these are the two hypotheses. So this is the end of my lecture. If you like the video, please do like, comment, share and subscribe. And in the second part, I will discuss about the symptoms, diagnosis and treatment. Okay, thank you for your attention.